Good evening, everyone. Am I audible? Can you hear me? So today we have very important topic, and it's a really very common problem nowadays. Number one, we will be discussing about the uric acid, and we know that uric acid is really very challenging problem and very common problem. And number two, we will be discussing about the diabetes, right? So we will be making the prescriptions of यूरिक एसिड एज वेल एज द डायबिटीज। तो हम दोनों की बात हम करेंगे आज। सो व्हाट इज यूरिक एसिड? वी हैव सीन when the patient is coming with the reports, and many times the level of uric acid is high. कई बार देखने में आता है कि पेशेंट की रिपोर्ट में यूरिक एसिड की मात्रा ज्यादा है। क्या मतलब इसका? कि अगर यूरिक एसिड खराब है तो बनता क्यों है? एनीवन, डू यू नो व्हाट इज द नीड ऑफ यूरिक एसिड? आखिरकार जरूरत ही क्यों है? अगर if the uric acid is not good, then why the body is forming it? What is the reason? Do you have any idea? I am sure that you have heard that many person coming to you with the disease of gout or the uric acid. कई पेशेंट आते हैं ना, कहते हैं कि गाउट हो गया, गठिया हो गया, गठिया बात हो गया। सुना है आपने? कितने लोगों ने सुना है? How many persons have listened that? Gout, गठिया. So what is happening exactly? So I will tell you. Actually, we know the human body is made by many systems. How many systems we have? We have nervous system, circulatory system, we have respiratory system, reproductive system. There are many systems in the human body. हमारे शरीर में बहुत सारे सिस्टम काम करते हैं। Then if you take any system, just take the circulatory system or the cardiovascular system. अगर हम सिर्फ circulatory system की बात करें तो ये we can see heart, then the arteries taking the blood, veins bringing back the blood, then heart is made by muscles. In the heart also we have lymphatic supply, so lymph vessels. In the heart also we have nerves, sympathetic and the parasympathetic nerve. So heart alone is made by many things. Am I right or not? So one system is made by many things. One system is made by blood vessels, nerves, lymphatic vessels. एक सिस्टम को बनाने में बहुत सारी चीजों का यूज हुआ है। So these, now let's go to the any system. Heart is made by many things. Heart is made by muscle. Even the we can see the skin is there, inner skin and the outer skin, inner membrane, the outer membrane. Now, if we go one more step, so heart is made by arteries and the veins and many structure. If we see the artery, even the artery is having skin, muscles. If we go deeper and deeper and deeper, what is the last product? What is the last unit of the body? अगर हम और गहरे जाएं तो आखिर में सबसे आखिर में क्या बचता है? That is cell, human cell. So how many cells we have in the human body? हमारे शरीर में कितनी cells होती हैं? Can you have idea? Millions of millions, uncountable cells found in the human body. Each and everything is made by cell. And what is cell? Cell क्या है? What is cell? The meaning of cell, The cell is a structure. Cell is like a whole family. One is commander, that is nucleus. One is generator, that is mitochondria. Then the ribosome, lysosome, there are lots of things in one cell. And who is the commander of cell? Tell me, हमारे cell का commander कौन होता है? Who is the commander of one cell? That is nucleus. Nucleus. Like if you see the India, Delhi is the main office, okay, of the Prime Minister. In the same way, if we talk about the cell, the nucleus is the commander. Now, if you go inside the nucleus, who is the man inside the nucleus? Even inside the nucleus, there is a DNA and RNA. Am I right or not? DNA and RNA, right? So ultimately, this whole human structure is made by DNA and RNA. Even the virus is having RNA. Even the small organism having DNA and RNA. Even the bacteria is having DNA. The DNA and RNA is made by protein, right? The DNA and RNA made by protein. So when we talk about the purine metabolism, जब भी हम purine metabolism की बात करते हैं, purine metabolism, right? The purine is the protein making DNA and RNA. प्यूरिन एक प्रोटीन है जो हमारे डीएनए और आरएनए का निर्माण करती है. So without the purine, you cannot even think for this whole structure without the purine. So when the purine is metabolized by the liver, जब प्यूरिन को टुकड़ों में तोड़ा जाता है लिवर के द्वारा, तो उससे बनता है यूरिक एसिड, राइट? So uric acid is the last product of purine metabolism. Got it? Now, we as a human, in the human body, how much uric acid is found in the bloodstream? हमारे शरीर में कुल कितना uric acid पाया जाता है? So the normal value of the uric acid found in the human body is, I will write here. So the normal value is near about 3.5 to 7.2 milligram per deciliter. Milligram per deciliter. This is the normal value of uric acid in blood. Now the person is having, I have seen practically, if the person is having 6.5 milligram per dl uric acid, even he might feel the pain. वो भी दर्द महसूस कर सकता है. Like as it crosses the 6.5 milligram per dl uric acid, the person might feel pain. So when the uric acid is coming in the blood, kidney is excreting it out. Kidney का काम है इसे बाहर निकालना. Kidney is excreting out. But if the level of uric acid is become too high, then uric acid is getting deposited in the bone. So it look like this. I will show you here image. When the uric acid getting deposited in the bones, so now so look at this image. You can see there are two bones, and between the two bones, there are too many crystals of the uric acid are deposited. ये दो हड्डियां हैं और दो हड्डियों के बीच में यूरिक एसिड जमा हो गया. So this part become inflamed. The person is feeling pain, redness, swelling due to the deposition of uric acid particle. Uric acid particles is mainly involving smaller joints, but slowly and slowly they can also inflame the bigger joint. And uric acid also target the heart. It will create many problems in the heart, right? So when the person is suffering with a uric acid problem, we also take care of the heart. It will damage the heart. It has been told uric acid is slow heart killer. Slow heart killer. It's killing your heart slowly, right? Because ultimately, this is the protein, one types of the end product of the purine. So when the person coming to you, the person is having pain as well as redness, right? Generally, what's happening? If we talk about the Ayurveda, in the Ayurveda, if someone is having pain, we can give hot medicine. Knee pain, okay, do the hot fermentation and take the hot herbs. But in the uric acid, we can't do hot fermentation because it's having the combination of vata and pitta. It's a combination of pain and heat. तो यूरिक एसिड में वो दो दोषों का कॉम्बिनेशन है, इसमें वायु भी है, पित्त भी है. इस कारण से हम इसमें गर्म सेक भी नहीं कर सकते और गर्म दवाइयां भी नहीं दे सकते. We can't give hot medicine. In the Ayurveda, there are all the medicine who reduce vata and pitta, like the Guilotinospora cordifolia. They are the very good medicines for uric acid. Otherwise, it's really very difficult and very challenging. So, as per the uric acid, this is the combination of heat plus, we can tell, because there are lots of redness, and as well as the pain, the combination of heat and pain both together, right? This is the combination. So when the uric acid becoming high, this condition is called gout, and it's a very famous condition and it's a very common disease. Now, we can't ignore the uric acid too much, otherwise what will happen? In the later on, आगे चलकर, if you are ignoring the uric acid, then it will make a tophi. You know what is tophi? So you can see here, this is the tophi. You can see in this image, the bigger nodules. We can see here, tophi lumps. These lumps are formed in the joints. ये joint lump का निर्माण joints में होता है, right? So these lumps are formed in the joints, and these are called tophi. And tophi can be at the many places. In even the tophi might be in the ear at many places. Sometimes these tophi become very, very bigger. Sometimes these tophi are very bigger, right? I will show you. Look at here. The tophi in the ear, this is also the because of the uric acid. Look at here in this image. You can see there's the tophi in the ear. This is also because of the uric acid. We can see there's a tophi. So this is just because of एंड दिस टॉफी आर वेरी हार्ड इन द नेचर, इनका जो नेचर होता है वो काफी हार्ड होता है, राइट। Rheumatoid arthritis is the different condition. This the uric acid is the different condition. Uric acid is having connection with the protein uric acid. Rheumatoid arthritis is not having connection with the protein and the uric acid. Rheumatoid arthritis is the more common in young female. It starts with very young age, rheumatoid arthritis. Uric acid is different, entirely different. There is no connections. Both diseases happening in the joints, but both the diseases are entirely different, right? So when you want to treat the uric acid, जब भी आप यूरिक एसिड को ठीक करना चाहते हो, as per the Dr. Bol, pancreas 1, 2, 3, and 4 points are very important. Pancreas 1 is the very good point for protein metabolism 1. And pancreas 2 is especially for uric acid metabolism. Pancreas 2. Pancreas 3 for sugar or the carbohydrate metabolism, and pancreas 4 is for fat metabolism. So right now we are discussing the uric acid. So let's discuss pancreas 2. What is pancreas 2? Pancreas means spleen meridian on the right side. So when you want to plan the treatment of uric acid, remember, जब भी आप यूरिक एसिड का ट्रीटमेंट प्लान करेंगे तो ध्यान रखिएगा, प्यूरिन को लिवर में तोड़ा जाता है. प्यूरिन इज कैटाबोलाइज्ड इन द लिवर एंड taking the form of uric acid. Okay. So purine is catabolized where? In the liver, right? Liver. So suppose you want to treat the uric acid, then you have to work entirely, you have to work in a different way. Let's start. How can we plan the treatment? So first I will tell you the treatment, then I will show you the location of all the points. So let's go one by one. Okay. So let's plan the treatment of gout. Point number 1 will be pancreas 2. The pancreas 2 is the good point for uric acid metabolism. Very important point. I will show you the location of this point very short. मैं इस पॉइंट की लोकेशन आपको बताऊंगा बड़े ही जल्दी से, राइट. Pancreas 2 will be the main point for uric acid, right? Then, because we cannot ignore the CMP point of the pancreas, I told you earlier, whenever you want to treat any meridian, you take the CMP point. So we want to treat the pancreas meridian because pancreas is responsible for the metabolism of the uric acid. So take the CMP point of pancreas. Are you able to understand this concept? So we will be taking 2 points of the pancreas. Number 1, pancreas 2, especially for uric acid. Number 2, pancreas 1A. Whatever the problem, whether the protein digestion is not happening properly, carbohydrate digestion, fat digestion, uric acid digestion, any digestion is not happening properly, we will be taking CMP point. CMP point means anything which is having connection with the pancreas. So the second point we will be taking, that is CMP point of the CMP point. Of pancreas. So we have taken 2 points of the pancreas. Number one, the point of the protein metabolism. Number two, CMP point of the pancreas. Now we are moving to the liver because protein is catalyzed in the uric acid is catalyzed in the liver. So let's move to the liver, right? So let's come to the liver. Now we are asking the liver. Okay, liver, tell me what you are doing. Why you are metabolizing too much uric acid? Why you are throwing too much uric acid in the liver? So liver is telling, what can I do? My fire is too high. If my fire is too high, I will metabolize. I will do the metabolism. I will metabolize. So if you can reduce the fire of the liver, what is fire? Fire means the organ is doing more function. That is fire. So we'll study the fire point of the liver, that is liver 2. So as soon as we studied the fire point of the liver, it will work in two ways. I will tell you. Look at here. If you look at the liver 2, so we know liver 2 is here on the junction of first and second metatarsal bone here. We have taken 2 point. We have taken pancreas 2 here, and we're taking the liver 2 here. So these 2 points are at the junction, and the mainly people are having problem here when they are suffering with the uric acid. So liver 2 is the fire point of liver we have taken, and again we will not forget the CMP point of the liver, that is the liver 1A. I will show you the location very shortly. So now we will be taking the 2 point of the liver. Number 1, liver 2. Yeah. Number 2, right side in the right level. Number 2, the CMP point of the liver, right? So let's write down. So for we are taking 2 point, liver 2 sedation and liver 1A sedation. All we have to set it, right? So liver done, right? So we have worked for the liver also, because liver might first we worked on the pancreas, then we worked on the liver, right? Now let's move to the kidney. Why to the kidney? Because kidney is doing filtration. If the kidney is doing more or less filtration, it will affect the uric acid. तो अब हम किडनी पर जाएंगे और किडनी से पूछेंगे, भाई what you are doing, whether you are doing the proper filtration or not of the uric acid, because kidney is doing the filtration of protein, uric acid, creatinine, urea. All the unwanted things are expelled out by the urine. So kidney is doing this work. So now only the pancreas meridian will be taken on the right side. All other meridian we can take both the sides, because pancreas meridian is only in the right side. We don't have pancreas meridian in the left side. हमारे पास pancreas meridian सिर्फ राइट में, लेफ्ट में है ही नहीं. तो पैंक्रियाज को तो सिर्फ राइट में लिया जाएगा, लेकिन जब हम लिवर की बात करें, किडनी की बात करें, हम बाइलेटर ले लेंगे. तो हमने लिवर का मामला खत्म कर दिया. अब हम किडनी की बात कर रहे हैं. लेट्स टॉक अबाउट द किडनी, बिकॉज इफ द किडनी इज डूइंग राइट फिल्ट्रेशन, देन आपके पास अच्छी छलनी है और चाय छान रहे हो तो बढ़िया छनेगी, और चाय के छलनी में बड़े बड़े छेद है तो पत्ती निकल जाएगी, है ना. तो छलनी हमारी किडनी, व्हाट इज किडनी? किडनी इज लाइक ए फिल्ट्रेशन सिस्टम. If the kidney is not working properly, so it might release more amount of the uric acid or the lesser amount of the uric acid as per the problem of the kidney. So we'll go to the kidney and we'll work on the kidney because uric acid also damaging kidney. कोई भी भारी चीज, अब कोई भी unwanted चीज, unwanted thing, like see, you know, when the urea is high, serum creatinine is high, uric acid is high, if they are high for longer time, they might also create problem to the kidney. So now we are going to the kidney and asking the kidney, okay, do you have some problem? Then kidney is telling, yes, I am little big. Okay, no problem. Tonify the source point of the kidney, that is kidney 3. किडनी को थोड़ा मजबूत कर दो, किडनी का सोर्स पॉइंट लगा दो और किडनी का भी सीएमपी पॉइंट लगा दो. द सीएमपी पॉइंट ऑफ द किडनी इज किडनी 1-3, दैट इज द सीएमपी पॉइंट. इतना करने मात्र से किडनी भी खुश. So ultimately we have taken liver 1, that is CMP point. We have taken pancreas 1A, that is CMP point. We have also taken kidney 1-3, that is CMP point, right? So ultimately पहले हमने protein metabolism को ठीक किया by pancreas. First we work on the protein metabolism. Then we went to the liver and improved the catabolism. Then went to the kidney and we seen whether there is a problem in the filtration system. Okay. So let's go and see all the points here. चलिए उसके बाद हम और भी देख लेते हैं. Sometime what's happening? Person is having allergy. Allergy, you know, you are eating the protein but not able to digest it. Your body is not able to digest it. As our age is increasing, many person not able to digest the milk. Many person are very fan of non-veg, but they are not able to digest the non-veg, but they still eat. So many person are eating the food because of their habits, but they are suffering a lot. Many person not able to digest the wheat. तो हम कई प्रकार के खाने को नहीं पचा पाते, फिर भी खाते रहते. कई लोग मीट नहीं पचा पाते, नॉन वेज नहीं पचा पाते, दूध भी नहीं पचा पाते, कई लोग गेहूं नहीं पचा पाते. A many person even not able to digest the pulses. दाल नहीं पचती कई लोगों को, but still they can't survive without the pulses. So they go in the intestine and they create lots of allergies there, right? So we will be taking the allergy point. Dr. Bol has given allergy points, right? Dr. Bol has told, if the person is suffering with the diabetes, it might also because of the allergy. Maybe you are eating something, you are eating the wheat, but you are not able to digest. There is allergy in your intestine. So if the person is suffering whether with the diabetes or the protein with problems or the carbo or the fat problem, we also have to think about the allergy of the lower part. Allergy in this entire area. So if we divide the body in 3 parts, lower part, middle part, and the upper part. So for this we have AD1, allergy degeneration 1. For this we have AD2, allergy degeneration 2. And for this we have AD3 or allergy degeneration 3. Any allergy in this part we are going to use AD1. Any allergy in this part we are going to use AD2. Any allergy in this part we are going to use AD3. So for this lower part we will be using AD1. हम किस पॉइंट का प्रयोग करेंगे? हम AD1 का प्रयोग करेंगे, right? So now I would like to show you the location of all the points. Before that, so allergy point. So allergy point of lower body, that is AD1, right? AD1. So now let's see the location of all the points. We are going to use 1 or 2 more points. We'll discuss after the location. Look at now. So first we have started our discussion with the point of pancreas. So look at here. The pancreas meridian is found only in the right feet, only in the right? So we can see here, हम यहां पर देख सकते हैं. Look at here. So this is the joint, middle joint. This is the, in the thumb we have only one joint, upper joint. Two joint, but this is the joint, distal joint of the thumb, of the great toe. From there, if we are going upper side, we can find the CMP point of pancreas, pancreas 1A, and the CMP point of the liver, liver 1A. We can find both the points. तो हमें दोनों पॉइंट मिल जाते हैं, pancreas 1A भी मिल जाता है, liver 1A भी मिल जाता है. Pancreas 1A will be treating each and every problem happening in the pancreas, whether the protein metabolism, fat metabolism, carbohydrate metabolism, or uric acid metabolism. And liver 1A is treating each and every problem happening in the liver. Okay, so these are the 2 points, right? Now, अब हम बात करते हैं, we are also will take pancreas 2 and the liver 2. So now look at this image. Okay. Now in this image, we can see this is a spleen 2. Spleen 2, where thumb is, great toe is ending. Spleen 2 in the left leg, the same point called pancreas 2 in the right leg. Now, if we go on the inner side here, so the outer side is, we have seen the spleen 2, the inner side we can see this is the liver 2, it's a written liver 2, right? तो हमने दोनों देख लिए, liver 1, we have seen liver 1A, liver 2, pancreas 1A and pancreas 2. We have seen both the points. Then let's talk about the kidney point. अगर हम किडनी पॉइंट्स की बात करते हैं, ओके, सो किडनी के हमने 2 पॉइंट्स की बात की थी. फर्स्ट वी टॉक्ड अबाउट द किडनी 1, 3. So let's see now. If you look at this image, this is the small toe. In the small toe, this is the middle joint. The point upper the middle joint, that is kidney 1, 3. Kidney 1, 3 is the CMP point of kidney. और किडनी 3 हम जानते हैं, किडनी 3 कहाँ होता है? किडनी 3 हमारे पैर में, मीडियल मेल्युलस के अंदर की ओर होता है. दिस इज द लोकेशन ऑफ किडनी 3. So we have seen 2 points of the kidney. So we have seen 2 points of liver, 2 points of pancreas, 2 points of kidney. Now let's talk about the allergy point. The allergy degeneration is found in the middle finger. Allergy degeneration middle finger में पाया जाता है. If you see the middle finger, on the index finger side we have pericardium meridian, but on the other side we have allergy degeneration meridian. तो हमारी इंडेक्स फिंगर की तरफ तो पेंक्रियाज मेरिडियन होता है और दूसरी तरफ हमारा एलर्जी डिजेनरेशन मेरिडियन होता है. एंड दिस द फर्स्ट पॉइंट वी कैन सी AD1. AD1 इन द टॉप ऑन द कॉर्नर ऑफ नेल, नाखून के ठीक कॉर्नर में AD1 होता है. AD1 इज अ वेरी गुड पॉइंट which is called allergy degeneration point of the lower body. तो हमने इतने पॉइंट लिए, right? So now let's add the last and the final point. Then this protocol will get completed. So let's see here. In this image only, first I would like to show you, इसी image में पहले मैं आपको दिखाना चाहूंगा. If you look at the pericardium meridian, which is on the index finger side, or it is called circulation meridian. तो जब यूरिक एसिड बढ़ता है, ये हमारे हार्ट को धीरे धीरे खत्म करता है. यूरिक एसिड इज अफेक्टिंग द हार्ट. So as per the Dr. Bull, we are taking 2 points from this circulation meridian and we are protecting the heart, right? So we are taking pericardium 8. First we'll see the location of pericardium 8E. So pericardium 8E will be, this is the point. This is the uppermost joint, and if you go just below that, that is called pericardium 80. Pericardium 80 we are taking with the purpose to protect the chest cavity. It is the point of chest plexus or thoracic plexus, pancreas 80, right? Okay, so now I will show all the points in the other image for clear instructions. Then, because uric acid is very, very common problem, and we can't ignore this problem. So look at now. So if we look at this image now, we can see all the bones very clearly here. Now our target, my target is to tell you the location of pancreas 2 first. So pancreas meridian is found only in the right leg, right? Only in the right leg. So if you see in this image, this is the great toe. Right? At the great toe, this is the joint. This is the lower joint or the distal joint. So pancreas 2 is the point found here. That is the pancreas 2 in the right leg. And pancreas 1 found just above this joint. That is pancreas 1A. So we have to use these 2 points. Now we talk about the liver. So liver is here on the other side, near about from the junction half to proximal. And liver 1A will be here, near about on the, I will show you. This is the CMP point, and this is also the CMP point. Okay, so we have seen 2 points. Now let's see once again. So if I am enlarging this image, if I see, we can see this bone. Just focus on the bone. हमें bone पे focus करना है. So this is the middle joint. Okay, this is the middle joint. This is the lower and the distal joint, and this is the great toe. So on this corner we have point. I'm not talking about the upper corner. Upper corner, the another point. The upper corner is pancreas 1, and this is pancreas 1A. So remember, I'm talking about this pancreas. In the same way, when I'm not talking about the upper point is another point. This point is liver 1A. So the Dr. Bull points are on the border of bone. Dr. Bull के जितने भी points हैं वो हमारी बोन के बॉर्डर पर होते हैं. So now, if we are coming, so after ending the grade 2, now this is the first metatarsal bone. ये हमारी पहली metatarsal bone है. So on this, because Dr. Ball point on the border, Dr. Ball points are on the border. So this is the location of pancreas 2, and this is the location of liver 2. Okay, in that way we have to choose the points. Now we talk about the kidney. अगर हम kidney की बात करें, kidney meridian as per the Dr. Ball start from the small toe. So if you look at in this image, a small finger, this is the small finger. This is the small toe. And having 3 joint, 1, 2, but it's very difficult to differentiate all the 3 joints. Okay, but there are 3 joints, right, in the small toe. The kidney meridian is passing from this inner side. This is the kidney meridian, right? And when we talk about the CMP point, जब हम CMP point की बात करते हैं, so we know this is the upper joint, this is the middle joint. CMP point found above the middle joint, so here will be the CMP point. This is kidney 1, 3. Okay. So in that way, we have to find out the kidney 1, 3 here. And kidney 3 is very well known point. Kidney 3 we already know. Kidney 3 की location तो हम जानते ही हैं. It's a very easily known points just on the inner corner of malleolus. So after the kidney 3, I will go to the allergy degeneration point. So let's see the kidney meridian, kidney point first. So the kidney points is here. We can see this is the kidney 3, right? Kidney 3. Okay, we know now. Now let's move to the allergy degeneration meridian. So look at allergy degeneration meridian found in the hands. So whenever we're talking about the hand, जब हम hand की बात करते हैं, so in the hand, this is the middle finger. In the middle finger, on the one side, we have pericardium meridian. But Dr. Boll telling it CI meridian. On the other side, we are having allergy degeneration meridian. This is the allergy degeneration. Okay. So now in the allergy degeneration meridian, the uppermost point, that is AD1, is for the lower body, which is working below the diaphragm. तो AD1 की exact location कहाँ होती है? Where the exact location of AD1? Let's see in this image. Now we can see this bone. So this is the border of bone, right? So the upper point is AD1 and the lower point is different, right? Because so we have to work on the upper point, on the border of bone. This is on the border of bone, AD1. Got it? Now, so now if we talk about the pericardium meridian, अगर हम pericardium meridian की बात करते हैं, let's talk about the pericardium meridian. So the pericardium meridian is on the inner side. This is the pericardium meridian, right? And we know this is the middle finger. This is the whole middle finger, right? In the middle finger, we have 3 joints. And the pericardium meridian is here on the side of the bone. So this is the point that is called pericardium 8E, or as per the Dr. Bull, CI8E. This is the point of plexus. Plexus means who is doing the whole supply to the chest region, CI80. So we are taking the CI80 point as per this image. So now finally, Finally, we talk about the full prescription made by Dr. Bol, which is the excellent prescription to treat the problem of uric acid. Let's see here. So we started with the pancreas 2, pancreas 1A, done, pancreas done. Liver 2, liver 1A, done. Here pancreas 2 is for protein metabolism or uric acid metabolism. Pancreas 1 is a CMP point of pancreas, right? Liver 2 is to reduce the formation of uric acid, and this is also the CMP point. Now kidney 3 and kidney 1-3. Kidney 1-3 is the CMP. Done. Then allergy degeneration meridian AD1, and finally circulation meridian CI8E. This is for plexus around thoracic and chest area. All the points are bilateral other than pancreas. तो ये हमारा प्रोटोकॉल तैयार हो गया. This is the protocol for gout or uric acid metabolism, right? So this is a wonderful protocol, and we can treat all the problem of the gout. Now, as per the concept of TCM and even the Dr. Bull concept, we can add one more point, that is kidney 1. Kidney 1 is the sun point of kidney who will expel unwanted energies from the kidney, right? Done, over. So 1, 2, 3, 4, 5, 6, 7, 8, 9 points are there. With the help of 9 points, we can treat uric acid metabolism. It's clear. I posted in the WhatsApp also, same formula. So we started our journey with the protein metabolism, uric acid metabolism. Now we are moving to the carbohydrate metabolism. All the points should be sedated. सारे point को sedate करना होगा, because see, if you all the points should be sedated because uric acid is excessive condition, right? Excessive. Kidney 3, yeah, you're right. When we talk about the kidney, because we have to strengthen the kidney. If we talk about the other point, it's okay. But when we talk about the kidney, we have to strengthen the kidney only just to tonify kidney point. Just to tonify 2 kidney points, that is kidney 3 and kidney 1-3. Just 2 points. Tonification. All other points should be sedated because we are improving the kidney. Even the sun point of the kidney, kidney 1, should be sedated. Kidney का sun point भी sedate होगा, वो तो sedate ही होगा. The sun point of the kidney should be sedated, right? So the question, you see, if you are asking, Mr. Kamalji, you are asking question again and again about the renal cyst, but it's the question, it is not like connected. So I'm not replying. Not at all connected. We are not talking about the kidney right now. We are not talking about the liver right now. We are talking about the uric acid metabolism, right? Uric acid metabolism. If we suddenly jump in a different questions out of leak, then we'll miss the theme, what we are discussing, right? Okay. So now, I have to close the session today. because I have to go. I'm going Mumbai tomorrow, so I have lots of planning in my mind. So tomorrow I will take a class from Mumbai itself. And if you have any questions, you can put in the group. I will reply from there. Okay. So safe travel. Yeah. Thank you. Thank you. So it's a very good news that in the Mumbai where we are doing class, there is internet connectivity is there. So I can take my evening class. Okay. So tomorrow we'll be discussing sugar and the carbohydrate metabolism. Even my Mumbai students also will join offline and you can join online, right? Thank you. So closing now. Okay, see you tomorrow. Good night.